All right, let's shift our focus to this story now. Health workers in Gauteng are marching to the Premier's office to present their grievances. Top of their demands is for government to end what they say is their exploitation. They also want a change in the hiring practice. Health workers are demanding permanent employment and not temporary contracts. Another sticking point is the patient-health worker ratio, where there are massive staff shortages. eNCA's Manqoba Mchunu joins us now with more on this story. Manqoba, what is the latest from health workers this hour?
Well, Mfundo, the health workers, of course, have converged here at the Library Gardens, where they're going to be marching from. They're heading to two departments here in the province. That is the Gauteng Health Department, as well as the Premier's office, where they're going to be articulating some of their concerns as far as some of the demands that they have on their memorandum. They'll be handing over a memorandum to those two officers. And of course, top of those demands is the issue of the insourcing of those workers, contractual workers, as well as agency workers, who they say should be absorbed by the departments. Of course, they say that there is a huge shortage of staff when it comes to health care facilities here in the province, which has led to a disruption in service delivery. Some of the patients not receiving adequate services from these facilities due to the shortage of staff. But to elaborate more about some of these issues, I'm joined now by Manqoba Mchunu, who is the General Secretary of the Health and Allied Workers Union, Haiti. Thank you very much, Manqoba, for your time. Let's start with your demands. Of course, one of the key ones is that you want those that are contractual and those that work for agencies to be permanently employed.
So the entire theme of the mass action today is really on the stopping of the exploitation of healthcare workers throughout the Gauteng Department of Health. We've got 5 groups of people that we feel strongly as healthcare workers that are being exploited, and this is expressed in our demand. The first thing is that we are saying EPWPs, which some of them have been exploited for more than 15 years. This contract is supposed just to be a 1-year contract. We give these young people a skill so that they're employable. When there is opportunities for them to be employed, they're excluded. They are ignored completely. The second issue is the issue of contract workers. We've seen nurses particularly being put as contract workers instead of for them to be on a short period, 2 years, by agency who squander all this money. And these workers have got no benefits, they've got nothing. A serious gross violation of labor rights of our workers. We have seen month-on-month contracts of security services, meaning that we are not safe as healthcare workers. We are not safe. Even our patients are not safe. Equally, again, the facilities that we are supposed to be keeping and safekeeping are not safe. So we are saying Gauteng Department of Health has failed dismally in ensuring our safety. They failed dismally in insourcing security. They failed dismally in ensuring that EPWP is converted to permanent posts in the roles that they are doing. And also, they get rid of labor brokers through nursing agencies.
Of course, you're also calling for investigations from the Gauteng Health Department on the exodus of what you say are some of the leaders within institutions. Tell us more about this.
Our motto has always been that people don't leave employers. People don't leave work. They leave the bosses that oppress them, that puts them under a lot of pressure. Gauteng Department of Health doesn't have enough talent pool as it is, losing close to 7 to 8 CEOs in our facilities and facility managers at clinics. It's a serious concern for us. Could it be that these managers who are at senior level are actually worried about something, and obviously as skilled workers they will opt to go. Some are even taking junior positions when they are leaving. But also, most worrying, we are seeing the posture, a negative posture that is taken by the Department of Health to take their friends to actually practice not just nepotism but cronyism, where they take their bodies and put them in positions that they are not qualified for, they are not experienced for, and they know nothing about.
And then let's talk about, of course, you have been quite vocal as then the young nurses in the trade union, now the Health Allied Workers Union. You've been quite vocal during COVID-19 about some of the working conditions in these hospitals, the lack of PPE in some of these institutions. What can you say about the current state of the public healthcare facilities? Has there been any change?
I think if we are flowing from the Ombudsman report on the Rahima Musa matter, where the Ombuds puts it out there and say this hospital is filthy. It's not even habitable for human beings. It's a serious indictment on our current leadership. We don't want to see people that are just walking facility by facility, pretending to be doing walkabouts. We need leaders that are going to be decisive in improving the infrastructure, the complexion of the healthcare system. And you're right, that starts with not just painting the walls. It also goes with making sure that the patient and staff ratios are correct, because that's how we save lives.
And in terms of the current working conditions, have they changed at all?
No.
You talked about overcrowding, the lack of resources, and the likes. Those are some of the concerns at the time. Has it changed?
Look, we are here today because of that issue of shortage of staff. If you are removing these EPWPs, you are removing these nurses from our payroll or from our department, it means you are leaving more skeleton staff. It means you are making us go even into a worse off situation that we are. We know at home patients are queuing from as early as 3 a.m. in our clinics because there's shortage. So if you are removing these ones again, what message are you saving? Are you sending to us, except that you actually do not care about the lives of South African citizens? In fact, the lives of those who don't afford private healthcare must be trampled upon. And we are not going to stand by and watch the Gauteng Department of Health do exactly that, and particularly the Gauteng Department of Health, because they are the ones that are actually the center of healthcare in the entire country, and they actually are servicing even the neighboring provinces around.
All right, thank you very much. So you're saying that you're going to be marching to these departments. What time are you leaving?
We will be leaving shortly, as soon as the program here at the Gathering Center is done, and we'll proceed to the Gauteng Department of Health. We are marching alongside Ilau and Al Jamal, who have an appointment with the Premier to also deliver a memorandum speaking about issues of healthcare, particularly the issue of EPWPs.
Okay, thank you very much for speaking to us. That was Lerato Mthunzi, who is the General Secretary of Hayitu, just elaborating some of their concerns and demands that are listed in their memorandum. Of course, they want an end to what they say is exploitation of healthcare workers. They want more boots on the ground as far as nurses are concerned at some of these public healthcare facilities, but importantly for the absorption of the expanded workers program that they say has been exploited by government, and also the issues around, of course, some of the leaders, the senior leaders that are seemingly leaving some of the key positions at some of these healthcare facilities. The march, as Lerato says, expected to leave soon. They'll start, of course, at the Gauteng Health Department before going to the Premier's office.